Fanta?
Good afternoon, everyone. I'm Fanta, and I'm the Vice President for Campus Life and Inclusive Excellence.
Steve?
Good afternoon, everyone. My name is Steve Munson, and I'm the Chief Information Officer.
Courtney?
Hello, all. I am Courtney Searles, and I'm the Vice President for Development and Alumni Relations.
Peter?
Hi, all. I'm Peter Starr, Acting Provost and Chief Academic Officer.
Billy?
Hello, everyone. I'm Billy Walker, Director of Athletics and Recreation.
Seth?
Hi, I'm Seth Grossman, the Vice President of People and External Affairs.
Great, thank you. And thanks, team, for joining us and all that you've done to get us to where we are with the plan that we're going to talk about today. I hope that everybody's had a little bit of a chance over the summer to rest and recharge, because I think all of us needed it like no other year in terms of doing that. And my family and I had a chance to do that. We were very fortunate, and the vaccine created a situation where both my mother and Stephen's mother came to visit, and we were all able to be together. And I'm actually not sure who was happier, the children or our dog Zuzu, that many of you all have not met, because Zuzu came to the family right before COVID started as a puppy. And so her trips to the campus, you're not supposed to let them walk until they get to a certain age with other dogs and other things. So hopefully when we return, you will see Zuzu too around the campus. But I'm hopeful that everybody got a chance to recharge and got a little rest. And now, as we're looking forward to the fall, it won't look like 2019. And that's because we learned things. That's a part of why it won't look like 2019 or 2020. And so today what we want to do is discuss our approach and our plan and take questions. Questions have been pre-submitted. A lot of questions have been pre-submitted, and that's great. A lot of the questions are similar, and that's great because we want to make sure we address those. But for questions that weren't pre-submitted, please use the Q&A. I can already see 5 in there already, but please, folks, feel free to do that. I'm not sure we'll be able to cover every topic, but know that we're going to keep updating the information and our Q&As and that information. And also, please remember to use fallfeedback@american.edu. We welcome comments, questions, everything. And as we think about this plan, this plan builds on where we are right now. And as a university, it was a difficult year, but I think, maintained our momentum. And that's big thanks to our students who were positive, resilient, and inspiring. It's big thanks to our faculty and staff who every day keep us delivering on our mission and building community. And thanks to our families who we consider our partners in the work that we do. And it has been a very hard 18 months. And so I know that different folks, we've all had a challenging time, but we're at a point where it's actually an exciting time. And as you can see, I'm in my office, and I've been in my office all summer in terms of coming in each day, and I've missed seeing everybody. And so I'm very excited to have everyone back. But I also recognize that folks may not be as excited as I am. It's been an isolating time. It's been a time of anxiety. There's anxiety about the change and how we're going to be coming back and questions and that sort of thing. There's anxiety about the Delta variant as well. And so I think it's important to name that and recognize that. I think it's also important to recognize that there is good news in that the situation is very different. And the most fundamental thing that makes this situation so different right now is that there is no better solution than a vaccine in terms of fighting the COVID virus. And I think that helps us really in a really important place. And, it is effective against the Delta variant. It is effective in terms of the variants that we have seen thus far. And Delta is dominant in the US right now. And this is why we took the decision that we did. We did that in the spring in terms of requiring the vaccines for our students and then joining our staff and faculty. So as we think about that important step in terms of good news that makes this situation very different than where we were a year ago. Right now, 90%, when we look at the numbers of our full-time faculty and our full-time staff are vaccinated. When we look at our undergrads, that number is also 90%. Our graduate students are in the high 80s looking, and we think that'll move. The exemptions that we have for religious and medical are around 2%, and we are continuing every day to do the follow-up to make sure that those numbers continue to move up. And as we think about the plan you're about to hear, I want to make sure that we connect back to those key decision-making principles that we talked about and have talked about since March when COVID started. Number one, the health and safety of our community. Number two, in terms of principles that guide our decision-making, it is the idea of how do we best achieve our mission of learning and scholarship in the context that we're in. And number three, how do we be proactive players in contributing to both our community and the broader community as we all fight a COVID pandemic. And so those are our decision-making principles. We're sticking to those as we have throughout this period of time. We're going to continue to listen to the science and listen to our community. And so what we're going to talk about today is our plan for our approach to this new chapter. Return is so important for our entire community. And our plan is a comprehensive plan that includes main campus, WCL, our folks who are over on Connecticut, our folks who are in New Mexico. And really, as we do this, we just want to make sure that we continue to be a special place to both work, live, and to learn. And one of the things we think is an important part of our plan and has been throughout the pandemic is communication. And that is a lot of what today's session is about. So we're going to go over that health and safety, some of our health and safety guidelines and decisions that we've made. And please know we're going to communicate regularly during the semester. I sent out a memo on Friday for those of you who haven't had a chance to see it. That includes a lot of information. We also have the website where you can go and look for answers and look at the Q&As. And we're having this discussion today. So hopefully that is something that we're going to learn. We'll all continue to learn in hearing from our community, but also hopefully gives you an opportunity to have your questions answered and discuss the issues on your mind. So with that, I'm going to turn things over to you, Fanta.
Thank you, Sylvia. So we did receive quite a few questions around health and safety, and we did put out our guidance around health and safety. And I just want to kind of refresh everyone's memory of where we are and where we're going. The mask mandate is certainly one of the things that we have in place. It is required indoors unless you're alone or alone in an office or residence hall in your apartment. And then also CDC does not currently have advisement around mask wearing outdoors, but we want to be more diligent. And part of that diligence for us, because we're a community and given the kind of activities that we engage with, anyone who's outdoors in a group of 25 or more, we ask that they be masked. So that's where we are. Vaccinations, it was already stated by Sylvia. We are making significant progress on vaccination, and that's because I think this community has taken seriously the importance of health and safety, and vaccination is the path forward. And we're really in very good shape there. As far as full-time faculty and staff are concerned, we are over the 90% mark, and in many instances, really in the high 90s there. And with students, we're making significant progress with the residential and off-campus students. And so we're working through that as we speak in terms of vaccination rate. And again, also for those who are eligible for exemptions, whether it's medical exemptions and or religious exemptions, again, it's tracking at literally less than 2%. And we do not anticipate that number going up much. And so that gives you a sense of where we are in terms of the community around vaccinations. We know that vaccination is an incredibly important tool, but we have a comprehensive approach to health and safety. So we will continue with testing. Testing required of all who are unvaccinated, and it will be twice a week for those who are unvaccinated because of exemptions that have been granted. And then in addition, we will also be having testing of those who are vaccinated if they meet one of three conditions. One, in case of exposure, again, not the advisement of CDC, but again, for the community that we are, we will want testing for those who may be exposed. Also, anyone who is exhibiting any potential symptoms, Even though they're vaccinated, we will want them to be tested as well. And then there's some folks for whom, because of their home conditions, because of other things, may want to, out of precaution, be tested, and will allow for testing at least once a week for those who are vaccinated. And so for us, we believe that it is not only to have testing for the unvaccinated, but also having some level of surveillance testing of our community as well. Daily screening will be required of all those who are unvaccinated, and will ask those who are vaccinated to continue to self-monitor for any potential COVID-like symptoms. And as soon as you believe that there's any potential COVID-like symptoms, we ask you to be tested. I also want to emphasize that with testing, we know that the incubation period is between 3 to 5 days. That is when really with the testing you can pick up if there is any COVID, if there's potentially any COVID positive. And so that is the other reason that when, for example, we have situations where we do contact tracing, we have our own contact tracing team, thanks to our Office of Risk Management, and a very capable team that has been working on this. And so I know we've gotten questions from faculty and others. Will I be notified if someone in my class or someone in my office tests positive for COVID-19? You will be notified if there is exposure. And if there is exposure, there'll be notification that is provided. There'll be contact tracing that will be done that is thorough, and then working in coordination with DC Department of Health. And we will be advising whether testing needs to happen, whether quarantine needs to happen, et cetera. And so that will be the way in which that we will be proceeding with contact tracing. So simply to say that masking, vaccination, testing, daily screening, contact tracing are all of the tools. Sylvia said that the vaccine is our best tool, and it is our best tool. I would say our second best tool is our community. How our community behaves and the way in which we continue to individually and collectively really abide by our health and safety guidelines is going to be incredibly important for the safety of each person and the safety of the community as a whole. And so that's going to be an important tool as well. The vaccine, absolutely, but our community is an incredibly important tool for how we engage with health and safety as we move forward. More information is available in the health and safety guide. Also, we have some guidance around PPE, because we've been getting a lot of requests from folks asking for different types of PPE, and we have to follow what we know are best practices around that. And so that guidance also has been issued. And we will have also guidance that will be available starting next week around events and space requests, because we want to make sure that our protocols are as comprehensive as possible around health and safety as well.
I think I'm going to take over to talk about operational updates. As part of our new transition to our new hybrid work environment, we are moving to a new way of work that will be part for the fall, but then be part of the AU work experience going forward. Under this new approach, some people will be on campus 5 days a week, while others will be working a combination of remote and on-campus presence. These arrangements begin on Monday, and we have worked very hard to develop a comprehensive plan, both around schedules, norms, and policies for this new way of working. That said, we know that the initial days of the return to work and the transition to this new environment will require us all to be flexible and patient with each other, and we're focused on supporting our teams as they return. As issues arise, teams can make adjustments working with their cabinet lead, with HR and others to make sure we are supporting our mission and providing the services we need to advance our community's goals. Our goal is to facilitate team engagement and community building with the return to partial physical presence. As we move through the semester, we're going to assess how the hybrid work is going and where adjustments may be needed for the future. We fully expect that we will do a lot of learning over the next weeks and months, and we will incorporate that learning and feedback as we make plans for the spring semester and beyond. As we return to work, we've gotten many questions about meetings. Business meetings can continue to be largely virtual so that we can preserve campus space for student-focused activities. Meetings of up to 3 individuals can be held in people's individual offices as long as masks are worn. And individual units, schools, and teams can make determinations about when and whether to hold in-person meetings in locally controlled conference rooms, using their best judgment to ensure safety, and having plans to support team members who may need to participate virtually. Official travel for research or business purposes will resume with updated protocols. Please refer to the travel guidance that's available on the COVID-19 resources website. Operations such as the AU shuttle services, parking fees, and the UPass system program and food services will be reinstated or reopened in the coming weeks. So there's a lot of change coming, but as Sylvia said, we're excited to move to this new way of work, and we are eager to support you as you make this transition. So Peter, I think I'm going to turn it over to you to discuss the academic approach.
Thank you, Seth. To better support our students and our learning mission, we're working with our faculty to ensure that we have the best possible learning experience in our classes this fall. Most of our classes, as has been mentioned, will be held in person, although classes with more than 50 students will generally be held online. The Washington College of Law has set slightly different size thresholds to account for instructional practices in the field of law. We sent guidance to staff in the Academic Affairs Division and to faculty this morning, including recommendations on how best to support student requests and to manage student absences due to COVID or other forms of illness. Our goal is to maintain an optimal learning environment while remaining flexible in the face of evolving conditions. We know that some students may need to miss classes throughout the semester for health reasons. In accordance with our standard policy, faculty should not ask for medical documentation from students. Given that we want any student who is experiencing symptoms of illness to refrain from attending in-person classes, we ask that faculty be flexible in granting short-term excused absences, that is, say, absences of 1 or 2 classes. The Office of the Dean of Students will provide notice of absence for those students who need to take more prolonged absences or undergo quarantine or isolation. As they would in the typical academic year, faculty may occasionally need to cancel or move an in-person class online. Faculty should communicate these temporary changes in modality for, say, 1 or 2 class periods, once again, to their students with as much lead time as possible. Decisions to make longer-term or permanent changes to modality will be made on a university-wide basis, following guidance, as Fonta suggested, from the DC Department of Health. We ask faculty not to change the established modality of their courses for longer than a week of instruction without permission from their dean. And to poach on Billy's territory just a little, athletics will resume all operations following AU's health and safety guidelines, as well as those put forward from the Patriot League and the NCAA. With that, Sylvia, I'll pass back to you.
Thank you all. Thanks very much. And hopefully what we try to do in that is do the quick summary version that could answer a number of questions for folks. And we will continue, as I said, to update. And as we learn and as we hear from our community, as we hear more about the virus and that evolution of where we are, we know that there are different perspectives. For anyone who's looking at the Q&A, you can already see those very different perspectives in terms of the university, and we want to continue to hear and learn. But I think what we know is that we have a resilient, we have a compassionate, and we have a caring community, going back to the point that Fonta made, and that is what's really going to be the backbone of how we go forward with our next steps as a community. So with that, a huge thank you to everybody for joining. And Matt, I'm going to turn things over to you to help us with the questions.
Great. Thank you, Sylvia. So as Sylvia mentioned, we received a number of questions in advance. Thank you so much to everyone for submitting them. We've grouped them into a couple of different categories that were of, kind of very popular interest. And we're also taking some of the questions from the chat. So we'll be doing a bit of both for the next little while. And so Sylvia, I'm going to start with you. One of the questions that we got a number of varieties of is, with the Delta variant and increasing cases in parts of the country, the questions around breakthrough infections, how are we going to manage the evolving health situation? Do you think additional restrictions may be needed at some point? And how are we going to make decisions about any significant changes that could be necessary?
So I'm going to start by answering this question kind of with my old hat in terms of the HHS hat, and a question that I'm getting asked a lot, which is the question of, are we going to shift back to what people often call lockdown in terms of where we go? And embedded in that question are some specifics for us, but let me start with the big picture. I think that we are in a place as a nation because of the importance of the tool that we have at hand, and the most effective tool that you can have in terms of fighting the virus, which is the issue of vaccination. And in the other thing that we're going to start to see, so the idea that things are going to lock back down, I don't think is what's going to happen. What I think we're going to see is we're going to see an increasing rate of vaccination that occurs. Over the fall, we're going to see the emergency use authorization go away. I think the indications from the administration when they made their announcement about DOD and said that it would speed up possibly from sometime in September is indicative to all of us that the FDA most likely is finishing up their work now. And we'll be making announcements about that. I think that's another step in the trajectory that we will do. I think what we'll end up doing is supplementing with some of the other tools that we know and are using. And that brings us to American University in terms of what those tools are. I think you all know, and Banta just went over it, we are masking indoors as a university. In addition, and this gets to the question of, are we going to change it? Embedded in that question, I know Matt's bringing a lot of questions together, but embedded when I'm getting this question at AU are three fundamental things. One, are we going to change faculty and staff modality? In other words, are we going to go back to a situation where almost all of our functionality was online? And the answer to that is I don't see that. Could we have a situation where a variant breaks through in a very different way? But the question I think you're asking me is what do we see happening and what are we planning for at this point? No, we don't see that as something that's likely to happen. The second question that's embedded there is, do we think we would send students home again? And that is not something that we see in our plans in terms of how we're planning to make sure that we do have isolation space when there are cases and to continue to work through that and some of the other steps. And I'm going to get to why I don't see these things happening in terms of the steps we're already taking proactively. Number three is the question is, will all courses go online again? And I don't see that happening either. And the reason I don't is right now as a university community, your question, we ask that question too. And what we've done is take a number of steps to try and make sure we're in front of that question. As I said, we're doing indoor masking, but not only are we doing indoor masking, where there are groups over 25, we're doing outdoor masking. In addition to that, we're doing testing and contact tracing. Many people are not doing the contact tracing anymore. In addition to doing the contact tracing, when we do the contact tracing, if you have been exposed, there will be a recommendation that you test. That's not what the CDC recommendations are at this point. You're supposed to wait till you're symptomatic. We don't want to wait, and that's how you'll get in front of these things. The other thing is we are allowing for the testing capacity on our community and paying for the testing capacity that those who want to voluntarily test, in order that I continue to test every week. So you all know I'm here every day. I'm fully vaccinated and have been for months. But I test once a week, and I do that as a member of the community in terms of I want to make sure that I am as safe as I can be for anyone who's interacting with me in the community. And so you all know Matthew's not 12 yet. Matthew will be 12 September 27th, and we have an appointment for that vaccination. We will get that appointment, and the poor kid, he's going to have to be vaccinated on his birthday, but that's how strongly we feel about it in terms of what we're doing. So I don't foresee us going to a place that lockdown, shutdown, and I don't foresee that as a nation, and I don't foresee that for us as a university. I think more and more institutions are going to choose the path that we did very early on and require the vaccinations. I think I think there are a number of steps that are going to continue down that path. And during this period of time, we are going to have to do things like the indoor masking, which we did not need to do before.
And Matt, may I add to what Sylvia said? This conversation and this question about the Delta variant and the breakthrough infections, I think there are a couple of things that are important to remember. There will be breakthrough infections. We know that there will be breakthrough infections. The question is at what rate, and then the question is what happens as a result of that. What we do know is, and that is part of what the efficacy of the vaccine is about, it is about hospitalization, it's about being severely ill, and God forbid anyone sort of dying. We know that based on the breakthrough infections that we've seen, it's been primarily mild symptoms. So I think it's important for the community to know, given any community that you're in, there will be some breakthrough infections. The question is, what percentage is that? Right now, the research indicates it is very, very small. And it is also more common within areas where you have still high rate of unvaccinated. That is not the situation that we're in within not only the DMV area, but it's not the situation that we're in when it comes to AU and where we are with our vaccination rate. So that's the other piece that I wanted to kind of add to this conversation around the breakthrough infections as we're going down this road. And this is a comment that continues to come up, and it's a very valid question to be asking. And as Sylvia said, the other key thing for us is transmission. The sooner you can mitigate for transmission, the better it is. And again, that is the reason why we want to continue with surveillance testing. And I know we've gotten pushback from those who are vaccinated. Why do you want to get us tested? Here's the answer. Even in communities, even if you're fully vaccinated, to have surveillance testing is good practice. And that is something that I want to make sure that we do. And so we are really putting in place these measures as a result of that.
And because we heard from the community about the question of I've vaccinated, a number of members of our community are like, I vaccinated, I don't want to test. I took that step, why should I have to test? We created a situation where it's voluntary. I, as a public health person, believe that the surveillance testing in the current environment that we're in the nation, in terms of where we are both with case count and vaccination rate, is something where surveillance testing could, I believe, is a very, very strong and important tool. We also, though, heard the community, for those that are vaccinated who feel that they don't want to do that. And so this is, these are complicated things, but what we tried to do is create an ability for those that do want to go ahead and do that, but for those who hold that other position to do that. And within the guidance, as I said, the idea that we are providing that opportunity goes beyond CDC guidance in terms of what they are recommending and requiring at this point.
Great, thank you both. We got a lot of questions on the topics of vaccines and testing, so we'll stay on the topic for just a minute. Font, I'm going to give you an easy one from the chat. Where is the testing site on campus?
Yeah, no, we will continue to do testing where we've been doing it this summer, which is Constitution. That's where the testing location is going to be. WCL will have its own testing location at WCL for their populations. And so that's how we're going about testing as well. In addition, at the start of the semester, because we will have international students who may not have had access to the vaccines the way that they needed to, we will be having vaccination clinic as well for vaccination. And while people are going through the vaccination process, they will have to be tested. They will have to take, all of the precautionary measures that we've listed in the health and safety guidelines.
Great, thank you. A question we've gotten, and this has been in the news recently as well, when we are collecting information about people, affirming their vaccination status, how are we verifying that? How are we making sure that people are actually getting vaccinated and that 90% number is accurate? You're muted, Sylvia.
Sorry. In terms of the issue of the validation and how we think about that issue, I think we start with the premise that we are a community, and a community with certain standards in it in terms of our behaviors. And just as we think that our faculty, staff, and students are not going to lie about all kinds of things, this is a place where I think we think that our community, it's important to trust the community as they come forward with this and do this. We know that, we have a group of people, as you heard the numbers, that we're working through, and we're continuing to pursue and have conversations individually with those individuals to understand where they are, why, why they haven't done the attestation at this point in time. And so I think the answer to that has a lot to do with the culture in the community that we want to create on an issue like this that's so very important. The idea that a faculty member at American University would lie about something like this in a situation where, I've lost my uncle to COVID. Like, I think, this is an issue that is of utmost health importance to all of us. And so this is a place where I think we believe our community is coming together and coming together to do it. Our rates are very high in terms of where universities are, and we want those rates to go higher. Fanta, I don't know if there's anything else you wanted to add to that.
Yeah, no, I think you have. The only other thing I would say to this, Matt, and Sylvia, going back to what Sylvia said, there has to be a level of trust in the community. Otherwise, you have other issues. And this question keeps coming up, and this piece about how are you making sure. I do not believe that you build rules, around the exceptions, and therefore create an undue burden on everybody else. The attestation also makes very clear that if someone has not provided the information and is incorrect, there are actions that can be taken, and believe me, they will be taken. In the case of students, they have to show proof of vaccination in addition to filling out the documents. And that's because, again, our students are used to immunization. Anyone under 26 had to provide immunization in coming to college, and this is in no way different. So I guess the way I would answer this question is, I do believe that there needs to be a certain level of trust and that you do not build systems around what is the exception. So that's my answer to that. The other piece about this as well is that I also keep getting questions that have been coming up, and it's around, what are you doing about the unvaccinated? And I want to turn that around and say, you and every single person needs to be thinking about their health and safety and needs to take the measures that are the appropriate measures for themselves. We also have to have a certain level of compassion and empathy, because those who are not vaccinated, there are legitimate medical reasons for why some folks are not vaccinated. And I sure hope that as a community, we have that level of empathy for each other, and that we do not begin to create stigma between the us and them, because that would be incredibly unfortunate for this community.
Great, thank you both. Peter, I want to come to you. We've gotten a lot of questions both in advance and in the chat about what happens in classes if either the faculty member or students have to quarantine, test positive. Will the classes, if the faculty member has to quarantine or is out because of a COVID positive test, what will happen to the class? And corollary, what will happen if a student has to be out? Will they have access to course materials? Things, how will that situation be addressed in the classroom?
Thank you, Matt. We have, as faculty, we have a lot of experience with short-term illnesses in the normal course of teaching in a regular semester. Obviously, it's ramped up, and these expectations are ramped up under COVID. We are expecting faculty to provide students with course materials, asynchronous work to meet the needs, the requirements of the course, as to accommodate their needs as they have to be absent, particularly absent for illness. Faculty members who must quarantine, we're asking faculty members, as we mentioned before, who experience symptoms not to come to work, to make arrangements with their deans and associate deans and department chairs as applicable for the coverage of their class, can take their class online for a short period of time as needed, but always working together with their academic leaderships, their department chairs, their associate deans, and their deans. The one thing that I want to say, Matt, in relation to all of this, is we don't want faculty changing the modality just unilaterally, obviously. We don't want faculty to be trying to respond to individual students' requests to change a modality. And the reason for this is simple. One of the things that we've learned a number of things, both at AU and elsewhere through the COVID pandemic. Let me just cite two. One is that faculty teaching in what's often called hybrid, but we like to call simulcast, that is to say 2 students online and 15 students face-to-face, does not work. We didn't do this because of the way we approached last year, but many universities did. It does not work. So we're really trying to stick with the residential experience, but understanding that there are going to need to be accommodations to be made. I talked about some of the accommodations to be made with respect to students and notification of student illnesses. Faculty need to work with their supervisors in order to make sure that the continuity in the course remains and that students get the best possible instructional experience.
Great, thank you, Peter. Yep, go
Prior
ahead,
to
Fanta.
that is also, I want to clarify this because this question has come up more frequently than not related to the classroom and others. The question has been asked, will faculty be given the list of students who are vaccinated? The answer is no. This is a university mandate, and the university therefore is enforcing the policies and the procedures related to the vaccine, and are asking that that not be something that community members take on their own. And so that's one thing I wanted to clarify, because we've gotten a lot of questions about that in particular. The same thing that if a student needs to be absent from classes, the Dean of Students Office will notify, but we will not give you the reasons if it's particularly it's a medical reason, because it's important again to understand the confidentiality around those different elements of information.
Fanta, in that same vein, do you want to just reiterate the contact tracing element there? Because I think that's an important component of how these kind of situations are managed. Sure.
So with the contact tracing, if someone tests positive for COVID-19, the contact tracing team will have the list, we'll do the contact tracing interviews to find out who was close contacts. If it's a class, we get the rosters, and then they pursue that, and we'll be in communication with folks by phone. And so we do ask people to please answer your call when the calls come in, because sometimes if there's a little bit of delays because they're trying to reach folks. And then based on the contact tracing work and the interviews and all of that, they make a determination of whether or not there were any close contacts. And based on those close contacts, we'll reach out to them and give them directions on whether or not they need to quarantine, they need to test, et cetera, or they need to isolate. And so that is going to be the process, and it's a thorough process around that, that would take place. And so if something has happened and that call hasn't come in, that is because it was determined that there was not close contacts in terms of the level of exposure.
And that applies not only to the classroom, but the office as well.
Office everywhere, anywhere on campus. That is correct.
Great, thank you. Seth, I want to come to you for a couple of workforce questions. We've gotten a number of questions about, how are we going to be supporting members of the workforce who have either high risk or immunocompromised or unvaccinated family members at home? Are there accommodations for those kinds of things, and how are we working through those issues?
Sure, thanks, Matt. So if an individual member of the workforce is themselves immunocompromised, they can request accommodation through our accommodation process. And if they have any questions, they should reach out to Employee Relations in HR. If a family member or someone in the household is immunocompromised or unable to get vaccinated, we believe our health measures that are in place that we've discussed, that Sylvia and Fanta have laid out, will protect our community members and their families. And as has been stated, the most effective preventative and risk mitigation device is vaccination, and we are very pleased with the rate of vaccination that our community has demonstrated. So those are the steps if you have questions around immunocompromised, whether whether it's about yourself as the employee or a family member.
Great, thank you. And a kind of a follow-up question to that we've gotten. Do we have plans if local K through 12 schools end up having to change their operating systems and there are childcare issues for faculty and staff?
So yes, but we want to sort of bifurcate that into two. If there are, for whatever reason, school systems have to close for a short term because of various kind of outbreaks, we do have plans in place to make adjustments. As Peter reflected in the academic side, and Fanta mentioned as well, we are well versed from the past of having to deal with short-term issues, and we have plans in place to adapt these situations. If local school systems decide to go all virtual, we feel a different situation than was in the case a year ago, and we will expect to largely maintain our modalities and provide support in other ways. We should say that we are, I think, all local school systems, from what we heard, are trying their very, very, very hardest to make sure that they come back in person. A couple school systems in Virginia, which start earlier, have already come back. School systems in other parts of the country that started at the beginning of August have already started to come back. So we are cautiously optimistic that all the school systems will come back and for a variety of reasons will try very hard to keep open status. But we are prepared to address either of those eventualities.
And I would just add, in terms of our support for the school systems, I think you all know that we engaged in getting testing capacity and partnering with other institutions. Our testing capacity, I saw one question, it is Solava based, to answer the questions for those who haven't had it. But our testing capacity, we basically paid for the lab in terms of getting this testing capacity, but partnered with others. It's located at Gallaudet. But we have allowed the Baltimore City schools and now the DC public schools to use testing capacity that is ours. And that is a part of, I think everybody knows in our strategy, Changemakers for a Changing World, there is that engagement with DC. And we see this as an important place for that kind of engagement and support for the district, especially in the area of education and making sure that everything's being done to ensure that K through 12 students can get back to that face-to-face work and education that we were doing. So everything that Seth said, but as the university works across things, I think important to recognize that we're actually trying to use some of our tools and actions to create that greater access as well, because the testing will be an important part of our K through 12 schools' ability to function.
Great, thank you. There's a couple of quick ones in the chat that I'll address quickly, and then I'll come back to a larger question that we're getting. First, folks were asking where the recording of this could be found, and it will be available on the website in about 24 hours on the COVID-19 resources page under the AU Forward Fall 2021 tab. So you can find it there. It'll also be linked in Sylvia's upcoming community messages, so plenty of ways to find it. There were also some questions about the air filtration systems in the building. And there's a great article on the website about that. Again, we'll make sure that's circulated so people can see it. All the air filtration systems were updated to the CDC MERV standards or higher over the course of last year, and that continues. So we're at the highest levels of air filtration right there. Doug, I'm not sure if there's anything that needs to be added to that, but the article really does cover all the good work that the facilities team did in that space over the last year. And we'll make sure that's available for folks. Great. The kind of other big topic we're getting a lot of questions on is events. And how are we determining which events can be in person, which ones have to be online? How will student organizations and clubs be able to conduct events? And what about external events? And Courtney, we actually got a few questions in the chat about development style events and also athletics. So Fanta, Billy, and Courtney, if you guys want to address a little bit around how we're managing events and activities.
So going back to how we're thinking about health and safety, I'd like to think of it in phases. I call it the first 4 weeks, what we have to focus on and what happens afterward as we monitor. So during the first 4 weeks, our goal is to really make sure we have our classes back, that we have our students in residence hall, that we have all of the workforces back, and closely monitor how things progress. So during those first 4 weeks, we have said we will limit, certainly the meetings are going to be, as Seth mentioned, will be virtual for the business meetings, because we need to have our rooms really for students, and so that we can prioritize students related gatherings and so forth, given that we are a residential campus. Also, during this period of time, there will be some events that will be allowed, particularly student-focused events that are allowed, with a preference for outdoors as much as possible. And then for indoors, we do have our health and safety guidelines that folks will have to follow for indoors events. For student organizations, they have to be recognized student organizations, and all of that would have to go through our Center for Student Involvement, because we need to make sure that our events are planned in ways that are taking into account the health and safety guidelines and measures. We are discouraging externally hosted events with a couple of exceptions, and those exceptions are admission related, development related as well. And so those are some of the ones, and of course, athletics as well. Those are some of the events, but even for all of those, we have health and safety guidelines that have been put in place to ensure that those events are being planned with health and safety in mind as well. And so I'm going to turn it over to Billy to talk a little bit about the athletic side, and then Courtney can speak to the development efforts as well.
Sure, thanks, Fanta. Yeah, we've implemented additional health and safety protocols for intercollegiate athletics activities, including practices, competitions, and the use of our training facilities. These protocols comply with university, NCAA, and Patriot League guidance. The health of our student athletes and staff is our primary concern, and we believe this approach can facilitate a safe, competitive season, which is critically important to our student athletes. We will continue to work on club and intramural policies and protocols as well. And just as an example, some of the athletics protocols that we put into place is universal masking when not actively competing or scrimmaging, single team training. The intercollegiate weight room has been on the Bender mezzanine to increase distancing, limited locker rooms use, training room controlled access, and weekly meetings of the Patriot League Sports Medicine Group to discuss league-wide policies. We've also developed an attestation form document for our visiting teams, as well as teams that we go on the road to compete against in accordance with NCAA guidance. And then, of course, our department has been in constant coordination with the Student Health Center. And I will pass that over to Courtney.
Thanks, Billy. We, you know that alumni relations development is a relationship-based business. So obviously it's been difficult to be remote for this many months. That said, it's a good time for a plug that this is a remarkable community of support. The university raised $58 million last year remotely, and $278 million now toward the campaign. So we know that with health and safety first, we know that we can continue our work. However, we are a relationship-based business, and I appreciate very much the university recognizing that when health and safety can permit it, as health and safety can permit it, moving forward with these relationships is going to be important. So that said, we are taking a very close look first, health and safety, second, at the purpose of the event. Can we gather safely if it's a small group? If it's a large group and it is too much of a risk, and we know that development and alumni relations may be 100% vaccinated, but when we're bringing in people, how do you make that comfortable when others may be coming in unvaccinated? So the questions that we are going through right now, even today, are, is there another way we can achieve the objective of this large event this fall, and then postpone to have it when we feel safer in the spring? Those decisions are being made in a case-by-case decision. And I just want to there were some good questions from the development and alumni relations, which are important too, since we are consolidating space. Just want you to know that additional guidance will be coming out on Friday, and we have an all-staff meeting to talk a little bit more about this next Wednesday as well.
Great, thank you all. We are getting close to the top of the hour. We've received over 100 questions in the chat and probably more than 100 in advance. So again, thank you for all of those. We're going to do our best to update the Q&A on the website with many of the main topics that we've either covered in the discussion or that we have not had a chance to get to. Many of the topics are already addressed in some form in the health and safety guide or the other resources on the website. So we do encourage you to look there. And as Sylvia said, you can always continue to send questions to fallfeedback@american.edu. The last question we'll address right now, and then we'll come back to Sylvia to close, is about travel. Can we expand on the travel policy for the fall? And if people do have to travel, do they have to quarantine when they get back? So Fanta or Seth, I don't know if you want to take that.
So we do have the travel guidance that's been provided for university business, in that anyone who's traveling for university business has to go through the process of completing the information. Our risk management does a full vetting to assess what the risk factors are, and then provides recommendations. And those recommendations goes to the designee within the respective unit and school to then be able to proceed accordingly with whoever needs to travel. To the question of quarantine, the quarantine provisions are going to be contingent on what DC requirements are, and or depending on where you live in Maryland or Virginia, what Virginia and Maryland departments requirements are for quarantine for travels. We know, for example, with DC, It is the case that for those who are unvaccinated, if you're coming back, you do have to quarantine. And so, Matt, that would be information that will continue to evolve, but that is not based on the university's guidance. It's really based on the Departments of Health guidance, and we'll make sure that that is communicated. And when folks are traveling, our risk management team will also make sure that those are things that are included in the recommendations and the guidance that they will need.
Great. Thank you, Fanta. And thank you all for all the wonderful questions. As we said, we'll be updating resources as we go to address as many of the topics as we can. With that, Sylvia, let me turn it back to you.
Thank you, Matt, and thanks to the team for the work that has gone into getting us to this plan and today's session, and especially thanks to the community for coming out. We had nearly 1,000 folks here in terms of this conversation, and that I think that's a great reflection of the engagement of our community and our engagement together. And so very much appreciate it. We know, as you can see, that COVID is something that has created challenges for everyone, and how people perceive those challenges are different, and how they experience those challenges, how each of us thinks about the calculation of risk, because that's what so much of this is about. It's about risk calculations. And so we know and recognize that, and know that all of our answers aren't going to be the answers that every single one of you hear. But what we've worked hard to do in this plan is to listen to the community, to listen to parts of the community, to understand. And as we've said, not every individual works, but what we've tried to do is create decisions, plans, and approaches that put the health and safety of our community first. That number two, make sure we deliver on our core mission of education and scholarship in terms of what we do and our best ability to deliver on that. And then number three, be a part of the broader solutions in a time that has not only tried each of us as individuals, us as a university, but our entire nation and the world. So that's how we've done this, and we continue to also consider the communication and listening to the science and listening to the community as the way that we are bringing together these decisions. I know we'll need to make more. As hard as we work to do as many Q&As before, there are always additional ones, and we welcome that. That's a part of how we learn and continue to strengthen the policies and approaches that we have. So a huge thank you to everybody for joining us today. For a number of you, I'm looking forward to seeing you at various points on campus at a distance. We'll be, outside. I'm sure we'll be waving as we'll have most of our meetings. As we've said, we'll be still in Zoom, but even just seeing folks across the campus is a good thing when we can do that. So I look forward to it, and thank you all so much for joining us today.